welcome everyone. Today we're here to talk about getting started with CII CPAR. If you go to menti.com and enter this code 31417543, we've got a couple of questions to ask you throughout the presentation just to make it a little more interactive and to hear from you. So we'd like to recognize that we're webcasting to and from many different parts of Alberta today. And the province of Alberta is located on Treaty 6, Treaty 7, and Treaty 8 territory. And it is a traditional meeting ground and home for many Indigenous peoples. So I'd just like to introduce the team who's presenting today. So my name is Angela Heitzman. I'm a consultant with the Accelerating Change Transformation team at the Alberta Medical Association. And I'm joined by my colleague, Kylie Kidd-Wagner, and my colleague, Chris Diamond. And Chris is going to monitor the chat and put in lots of useful info for you. So please don't hesitate to ask questions in the chat or for the Q&A, or save your questions for the Q&A at the end as well. So welcome this afternoon. It's good to see lots of familiar names and some new people. So that's really awesome. So what we're going to talk about today is what is CII CPAR, where it came from, and how it works. We're also going to talk a bit about benefits to patients, physicians, and teams, what you share from your community EMR, what you get from that sharing process, and then how to get started. Right at the end, we're going to talk a little bit about answering your questions, or we're going to answer your questions. And we're also going to give you some information about how you can reach out and get some support. Our first Mentimeter, so like I said at the start, if you go to www.menti.com, and that code is 31417543, it's in the chat, and it's also going to be on the screen in a second here. So it looks like we've got a majority at the moment coming from Edmonton Zone, but a few from different areas as well. Nice to see the range across the province. And I know that we have different types of clinics represented here. We have PCN staff, and I think we even have a couple of physicians today. So nice range of people from the health system across Alberta. If you are a practice facilitator, or if you have to run meetings and you want to make them a little more interactive, Mentimeter.com is actually pretty fun. And I think you can get a free subscription. So you can do polls like this yourself if you want to break things up from the whole PowerPoint monotony that sometimes happens. All right, well, it looks like we got lots from Edmonton, but some scattered across the province, and we will actually come back to the Mentimeter. So don't worry if you haven't answered this question. You can keep answering in the background while I move on. CII CPAR, what's the big picture here? So for those of you who work in healthcare, I'm sure you know about Alberta NetCare, which is the electronic health record for patients in the province. There's also Connect Care. So if you're familiar with AHS systems, there's currently 1,300 databases, data systems that are all being brought into one, which will be called Connect Care. It's partway through its rollout, but we've got a few more years to go, and it's phased. So if you are working in Alberta Health Services or work alongside some AHS people, you might want to look at their rollout plan. It's been changed a few times because of COVID and other things. So anyway, right now there's a bit of a connection between the two. But where there is not a whole lot of connection is over here on the left-hand side. You can see these bubbles that represent all the community EMRs. So these are the 5 EMRs that are involved in CII and CPAR, and currently, or without CII CPAR, they're quite disconnected from the rest of health information systems. So CII, other than currently e-delivery, so your lab test results and diagnostic imaging, all that will come through this e-delivery, which was one of the early parts of Connect Care's implementation. But community information integration, or CII as we know it, is kind of the wrapper around Alberta NetCare. So this is where it facilitates a two-way flow of information between EMRs out in the community and to NetCare. So for those of you who are from non-family physician offices, if you're from a specialty office, for example, this is the really important bit for you, because this is where you can use the technology to upload consult reports. Well, and that's same as well with family physician offices, but yeah. And the Central Patient Attachment Registry, which is the CPAR part, we always talk about CII CPAR, and we sometimes forget to say what those acronyms are. So the CPAR aspect is where this captures the primary relationship between a physician and a patient on a panel. So generally relevant for your family practice, but also for, so physicians in family practice, also nurse practitioners, and it's also true of some pediatricians will have paneled patients as well. And this is that enabler there that allows for lots of useful information to go back to the paneled provider. We also have the healthcare data repository where a lot of anonymized data will flow from Netcare. So from the EMR into Netcare and out into the healthcare data repository. That will enable for kind of system level planning across the province. And finally, we also have what's known as My Health Record, which is really the patient portal into Netcare. So the more information that is available in Netcare, the more useful that is across the provincial landscape. So it's important to note that CII and CPAR were actually requested by physicians. So Central Patient Attachment Registry was a request of the Section of General Practice, now known as Section of Family Medicine. And Alberta's community specialists were also requested the technology to submit consult reports to Netcare. That's what became CII. And back in 2018, these two projects merged together, hence the big long acronym CII/CPAR that we always say. So just so you are aware, it was requested by physicians and it is supported by partners, including the Alberta Medical Association, PCNs across the province, Alberta Health, and Alberta Health Services. So we're all working together to make this a reality. So I'm going to pass over to Kylie. She's going to talk a bit about what information is shared and what's received.
Awesome. Thanks, Angile. Just provides a very high-level overview of what's shared, received, and how what is shared can enhance Netcare, such as the consult reports and what is called the Community Encounter Digest. So from community EMRs, confirmed panel information can be shared, select patient encounter data, as well as consults should providers do consults. And in turn, what can be received through CII is e-notifications, as well as panel reports. We can see that depending on what you share and receive really depends on the type of practice that you have. So family physicians, as well as nurse practitioners and pediatricians can participate whether they have a panel or not. So in the event that they are without a panel or have maybe a walk-in, or pediatricians who do just simply consults, you can submit encounter information as well as consult information. So that is similar to your specialist colleagues in the community. But should you operate with a panel of patients, you also can submit panel information, which enables you to receive e-notifications. So let's go in and take a look at what the different types of reports look like, starting with the Community Encounter Digest. So this is one of those reports that is available in Alberta Netcare. So information from the community is being made available to anyone providing care to patients in the system who has access to Netcare. So I think one of the important things here is that if you have a panel or not, you can contribute to this report in Netcare, which is essentially an assembly of information from visits that patients have with providers who are signed up for CII. And what it does is it provides a rolling snapshot of 12 months with the exception of referral information. And so you can see here all the different types of data points that it provides from community EMRs. The one that I would like to point out, which is a little bit grainy on my screen, is that disclosure message. And that ultimately, what that says is that this is not a comprehensive medical record, as it only includes information from those who are participating in CII. So that's a very important thing for those who are accessing it to see. So let's move on to the next slide, which is about confidentiality. So I think it's really important to note that not everything is flowing up from the clinic EMR into Netcare. So you've heard me use select encounter information. So what you see in that CED is actually mapped from your community EMR. And that's a process that you go through with the person who is supporting you, so your practice facilitator or someone at the AMA, should you not belong to a PCN. So they can take you through what exactly will flow from your particular community EMR so that you know exactly what is going up. And once live, you also have the opportunity to choose to use functionality that enables confidentiality in your EMR, so sensitive information does not flow up, or you could choose to use unmapped fields as well. And as far as letting patients know about what it is that's going up, there is a poster available. It's called the Health Collection Notice, and you can use that to replace the current Alberta NetCare poster you have in your clinics, letting patients know that information is being shared. I'd like to just share a story that really highlights the value of information being widely available across the system, and particularly the Community Encounter Digest. So this is a story from a family physician in the North Zone, Dr. Joseph Ajetikin, where that CED really had a positive impact on the patient's care. So after going live on CII CPAR, one of Dr. Ajetikin's patients was admitted to hospital with a hemorrhagic stroke. So following surgery, the hospital staff found that her blood pressure was quite high and kept her in the ICU to try to determine the cause. Now, thankfully, if we go to the next slide, CII CPAR enabled the patient's attending physician to see in NetCare that Dr. Joseph Ajetikin provided care to this patient over the past year, looking at that CED, so that Community Encounter Digest. So that enabled the attending to reach out to Dr. Ajetikin, and Dr. Ajetikin was actually able to share that this particular patient was an active crystal meth user. And it was with this critical piece of information that the attending was able to change the patient's treatment plan, medication, and ultimately able to stabilize this patient. So you can imagine if that patient, if the CED had not been there, the attending would not necessarily have been able to act as they did to stabilize the patient. And also, I would say that for Dr. Ajetikin, that connection also enabled a smoother transition of this patient back into his care in the community. All right, so let's move on to the next type of report that you can share in NetCare. So consult reports can be shared by anyone, whether you have a panel or not. Again, I think Dr. Joseph Ajetikin's story really highlights the value of information being available from the community to a wider group of people who are providing care to the patient, no matter where the patient accesses it. And I will just mention that they're similar to confidentiality that we talked about before. People who are submitting consults can choose which consults they do and do not want to submit. So that is an option available to you. All right, so let's move on to the next type of report. And as the title there, the panel reports insinuates, this is for people who have panels. So for nurse practitioners, family physicians, or pediatricians with their little people panels. All right, so demographic mismatch. So this is the first type of report that you would receive as a participant of CPAR. And so you can see it provides information about patients who are deceased as listed in the provincial client registry. And it also provides information when there's a discrepancy between what is in your EMR from a demographic perspective and what is available on the HS side. So we've heard providers find value in these reports, knowing when patients are deceased and not necessarily having awkward conversations with family members, having not known that prior, but also that they can use this information to adjust what it is that they have in their EMR so that information flows up to CII CPAR appropriately, which in turn enables them to receive e-notifications, which we'll get to. And given the audience that we have here today, I think it's important to mention that we have heard that those submitting billing information have found these reports valuable as well to ensure that information is reconciled on both ends to prevent rework. This is an example of what you would receive should you be submitting to CPAR or have a panel. And so this report really gets to I think, one of the original requests of what family physicians wanted when they requested that CI, CPAR, or CPAR became what it is. And so this tells you when a patient on your panel is also on another CPAR patient or CPAR provider's panel. And it provides information around when that was confirmed and the last date of visit. So this is really an opportunity for clinics or providers to reach out to explore why that is. And ultimately, the goal being that patients are receiving continuity of care from a single provider, which is where we start to see the benefits within our system, not just for patient outcomes and satisfaction, but to providers as well, and preventing costly care that can ensue when patients have to be admitted to the hospital for long stays. All right, so let's get to the last type of information. So this is e-notifications, and often I will say that this is the type of report that those with panels find the most valuable, as it provides the opportunity for timely follow-up with patients and smoother transitions back into their care. And so e-notifications come when any of the different types of visits happen in acute care that you can see listed there along the right-hand side. And the great thing about e-notifications is that they're automatic. So they come into your EMR twice a day, 7 days a week. And again, they're that opportunity to provide that timely follow-up care. We can see here what an e-notification looks like when it's open. So it provides the pertinent information that you see listed there, information included. And there is new functionality that has been added, which enables you to see when a patient has passed away in hospital. And also there is, it lets you know if that particular patient is also on another CPAR provider's panel. All right, so now we're gonna play a clip from a physician in Edmonton, Dr. Janet Craig, who has a really great story about how e-notifications really enabled her to provide better care to her patients in her practice.
So, the big question is, what difference has CII CPAR made to me and to my patients? So I wanted to tell you a recent story. Around New Year's, I received an e-notification that a patient of mine had been discharged from emergency. And at the moment, depending which hospital they've been at, you sometimes don't get a lot of information. So all I knew was that he had been to emergency and he was discharged, and the diagnosis was an upper respiratory tract infection. And I went on Netcare, and it didn't have the emergency report yet. And there was no mention of any lab tests or chest x-rays or anything. So I had not much to go on, but he's elderly. So I gave him a call to see what the story was. And what he told me was that he went to emergency because his common law partner was in the hospital with a very serious case of COVID. And he was worried that he had COVID and he was having difficulty breathing. But when they checked him in emergency, he was his oxygen level was pretty good, and they felt that he could manage at home. So that allowed me to check later that day for his COVID test result, and sure enough, it was there and it was positive. So then that allowed me to activate the COVID pathway and go through with him and phone him every day, because he was 77 years old and had hypertension and a couple other conditions. And I could check every day and see how he was doing, and had given him kind of red flags to watch for. But also, as it turned out, unfortunately, his common law wife died of COVID. So I was also able to provide emotional support. And I think that was very useful to him, especially because he was isolated with COVID. He couldn't have family members coming to see him and so on. So he looked forward to that phone call every day. So the bottom line is, I would not have known that he had gone to emergency unless he had contacted me himself, because I didn't get the emergency report for about another 10 days. And I wouldn't have gotten a copy of that COVID test result because it was done in emergency and didn't have my name on it. So that's just one story amongst many that myself and my colleagues can tell you about what a difference CII CPAR makes to our patients and to us.
Take it away, Angile.
Thank you. So the first step is to just be aware that you're not on your own. If you're part of a PCN, there's probably a PCN facilitator who can help. If you don't know whether you are a part of a PCN or who your contact is there are a couple of email addresses on the screen that you can contact. So if you're a family practice, if you go to continuity@albertadoctors.org, or if you're a specialist clinic, CII-specialty@albertadoctors.org, someone can put you in touch with the right people. We also have lots of self-serve information down at our website on the bottom of the screen there. So that's act.albertadoctors.org /CII-CPAR, or you can navigate through the screen to find that. But really, the prerequisites are pretty brief here. There's about 4 things. One is that you need to be using a conformed EMR. So that would include HealthQuest, Acuro, and the TELUS products, MedAccess, PS Suite, or Wolf. So if you're on one of those 5, you can join up. You also need to be live on Alberta Netcare, but you can make that happen while we're looking to sign up. And then you also need to get your privacy impact up to date. Although there are processes during the sign up process that you can help you walk through that. And you would also get a bit of an hour, I think it is, of consult time with the privacy specialist from eHealth if you sign up. And then finally, you need to be panel ready. And that doesn't mean that your panels have to be perfectly clean or you've got all the processes ship-shape, but it just means that you are working on keeping your panel tidy. And there's a really great panel readiness checklist that you can go through on our website that hopefully someone can stick in the chat there for you. And get you ready for the panel side of things if you are a clinic with panels. If you don't have panels, you don't need to worry about that one at all. So who will do what at your clinic? Well, the very most important person you need to nominate is a site liaison. So this would be the main point person at the clinic for the onboarding and the ongoing processes. So there's lots of forms to fill out, unfortunately, but we can't get away from that. So there's some form filling to be done, and then also some awareness and training for the rest of the clinic. And that's the main person that would be interacting with the eHealth consultant. If you have panels, you also would need to identify someone who can be the CPAR access administrator. And that's just giving access to those reports in Netcare and CPAR. And then finally, a CPAR panel administrator who would be downloading those reports that Kylie walked through and would also support some of those clinic panel processes. So, and then there's also some supporting roles. As I mentioned, there are practice facilitators and panel managers available through some of PCNs. And those can help, a lot with guiding you through some of the questions that you might have around CII, CPAR, supporting those quality improvement activities once you go live. eHealth support services, someone from eHealth will be assigned to you once you submit your confirmation of participation form. So that's just the form that says we're ready to go, and these are the people who are interested in doing it at our clinic. They'll also put you in touch with that privacy impact assessment consultant. And there's also people from Alberta Medical Association, so people like myself and Chris and Kylie who are on the call with you today, that we can help you out. So if you were able to take down those email addresses, the continuity@albertadoctors.org or CII-specialty@albertadoctors.org, someone will be able to help you from AMA if you need it. And this is the confirmation of participation form. You can find it on our website. And really, it just walks you through all of the information that eHealth needs to help get you started. So the clinic details, who's doing what role. So for example, who's the site liaison. If you have a practice facilitator that you know of, they can have their name on there too, and they can ask them a few questions. There's a few questions around your prerequisites, like which EMR you're on, etc., and a number of other pieces of information. And probably one of the most important is those providers that are in clinic that you want to sign up. So that would be the list of names of physicians, any allied health professionals, et cetera, and the different, things that they'd be interested in. So do they have a panel? Would they just like to use consults, et cetera? So all of that information is covered in there, and those support folks that we mentioned can help walk you through that form as well. And on our website, there's a guide to filling it out. So hopefully you should be able to get that done. And something that's really important to remember is, CII CPAR is actually teamwork. So it's not all on you if you're the clinic manager joining today. There are other people that are there to help you. So we've got a great quote here from Roseanne Oyama, who's a clinic manager in the Edmonton area. At first, I was concerned about what I would need to do to get us on CII CPAR, but Amira and Jason from the PCN and the eHealth consultant made it easy. I felt very supported, and in the end, it wasn't a lot of work. So I think that's a great testimonial to, if you ask for help, and, it doesn't have to be a big burden for you. So you've got your team here that we've listed, the folks within the clinic. If you've got a PCN that you're working with, there will be folks there. There's also ACT and eHealth to help you out. We're going to go back to our Mentimeter. What feature of CII and CPAR excites you the most? So we have, the first one is sending encounters to the CED, sending panels for e-notifications, sending panels for panel conflict reports, sending consults. Is there something else? If we, if those things don't work for you, is there something else that excites you about CII CPAR? Tell us in the chat or come off mute and let us know what you think. I see one person's picked something else. So if that person feels brave enough, let us know what you think, what else about CII CPAR excites you. I see lots of people are voting for, well, it's pretty evenly matched really, but lots of people were voting for sending panels for e-notifications, conflict reports, sending consults. Interesting though, not as many people voting for the encounters to the CED. So that's interesting. Okay, well, let's move on to the next couple of slides. We're almost finished. And I like that the e-notifications is coming up there. It's good to see. As a patient, I'm excited about it all. Yes, absolutely, Sue. And the provincial e-notifications, that's a really good one. We've done a bit of data analysis for some of the clinics about where their e-notifications are coming from. It's actually quite surprising to see how many are outside of their kind of area that you would imagine. So it's not just all the Edmonton area hospitals for an Edmonton physician, it's literally everywhere. And even in some of the smaller areas, you might think that maybe your patients aren't moving around, so much, but they really are. And, you might find, even if your clinic is in Lethbridge or something like that, you've got your patients ending up in ER in places like Fort McMurray or Calgary or just about anywhere. So, all right, let's get back to the slides. My primary care providers are concerned about what information we'll be seeing. Yeah, absolutely. And that's why those confidentiality resources are really important to work through. And just to see what actual data is mapped to the CED. So you know exactly what it is that's going up to the CED, and you can mask certain pieces of that. So for example, youth who are trans and don't want their parents to know. Yeah, for sure. And certain diagnoses, STIs, things like that, people might not, be comfortable with that being shared. So those are always possible things that can be masked from moving up into net care. I just wanted to make the point again that if you're considering starting this journey, please don't hesitate to reach out either to your PCN if you're involved with PCN, or to one of those albertadoctors.org email addresses. Someone there will be able to direct your inquiry or give you some support. So you're not in this alone. Thank you so much for joining us. Please don't hesitate to reach out to us or to your PCN if you have a PCN associated with your clinic. We're happy to help. We really think this is a great program, and we'd love to get everybody on board. So,
yes, thanks everyone.